Namaste. Welcome to Psychiatry Simplified, the leading channel where we cover all things psychiatry and neuroscience related. My name is Sanil Rege, consultant psychiatrist, founder of PsychScene and Vita Healthcare. I am filming in Bali, and there's no way I wouldn't do a video on meditation and mindfulness. Bali is an amazing place, and many people come here specifically for a range of retreats, meditation retreats, etc. Now, I'm not the person really for meditation, but in this video, I'll be taking you through the neurobiology of meditation and mindfulness, because there are other ways of meditation and mindfulness that we all potentially do on a day-to-day basis without even knowing, but at the same time, we may include activities that are physical in nature that also constitute meditation. So let's get into the neurobiology of meditation and mindfulness. Mindfulness and meditation strategies are becoming increasingly popular ways to relax or manage conditions such as anxiety or depression. Now, there are 4 specific brain functions that are implicated. These include attention regulation, bodily awareness, emotional regulation, and self-regulation. Now, each of these map onto specific brain areas, and we'll cover that. Meditation involves directing attention internally for either relaxation purposes or to achieve personal or spiritual growth. It can be split into 2 different categories. The first one involves focusing on bodily sensations such as breathing, carrying out progressive muscle relaxation, yoga, or Tai Chi, for example. Now, as part of clinical practice, it's quite common to incorporate many of these strategies as part of psychological strategies or psychosocial strategies within groups, etc., as overall care within psychiatry. The second type involves focusing on static or repetitive foci, such as mantras or transcendental meditation. Examples include Zazen or Benson meditation, as well as ostinato drumming and rhythmic dancing or drumming, where a pattern is repeated for long periods of time in order to induce a trance-like state. By practicing sustained and active curiosity, acceptance and openness, connections can be made between inner mental and bodily experiences. Attention to the surrounding environment is also enhanced through greater synergy between one's inner and outer self. The term mindfulness, on the other hand, is often used to define mindfulness training, which was summarized in the book by Jon Kabat-Zinn in 1990. Here, unhelpful thinking patterns are combated through the purposeful and continual mind and body awareness. If the process of mindfulness is mastered, and this is what's postulated, automatic negative thoughts or patterns of rumination can be broken, and psychological stress can be reduced by keeping attention on the present, the here and now. But the statement where the attention regulation is really important in keeping check or combating these thoughts points to the important role of the prefrontal cortex. When one is meditating or being mindful, neurotransmitters such as dopamine and melatonin increase, serotonin activity is modulated, and cortisol, the stress hormone, and noradrenaline decrease, particularly as the body relaxes and the heart rate and the blood pressure slow down. Essentially, this component points towards parasympathetic nervous system activation, which is part of the parasympathetic, the vagal part, the parasympathetic part. These actions are said to produce the clinical effects observed through mindfulness or meditation, particularly in stress-associated diseases, particularly anxiety, even in cardiovascular diseases, immune diseases, pro-inflammatory diseases. Now, formal mindfulness training consists of a set of exercises and techniques designed to balance attention and awareness. One should recognize that routine provides mindfulness, just as in the book Ikigai or in the Japanese concept of Ikigai. This is another video that we've covered in more detail, whereby mindfulness occurs through routine actions. Informal techniques promote mindfulness as a desired state of being. For example, daily activities and rituals such as dishwashing, shopping, speaking, brushing teeth are all activities that can be considered as mindfulness activities. These informal actions turn mindfulness into an everyday way of being or living. Being in a flow state, for example, is a form of meditation through action. And the reason why this happens is that there is a continuous activation of the dopamine D2 receptors when we're in the flow state, but these D2 receptors are very much in the striatal part of the brain, and it's what we call monotony, which is essentially that flow state. The key circuits or the key parts of the brain involved are the mesolimbic pathway, which is the reward pathway, but also the striatal pathways. So here we see two parts of the brain involved, the reward, which is mesolimbic, and the mesostriatal, which is the motivation pathway, with dopamine, as we know, as the leading neurotransmitter that mediates both these processes. Authors Esch and Stefano in 2004 were able to directly prove the presence of dopamine both in the brain and in plasma in connection with meditation. Meditation also modulates stress, and at a molecular level, through the modulation of noradrenaline. Brain-derived neurotrophic factor and other stress-related elements have also been linked to meditative practices. There is some evidence that in experienced individuals who carry out meditation, gamma waves are present during the meditative state, which is a very, very high frequency wave, even more than the beta wave, and this highlights a very strong prefrontal cortex awareness. Now let's look at how meditation can help with stress. We know under stress, frequently automatic mental patterns are formed as part of the cognitive stress response. And this can occur because under stress, the amygdala is firing. We know that the amygdala firing reduces prefrontal cortex functioning to a more rigid way. Cognitive flexibility decreases. And that's really this cognitive stress response that occurs. Now, such patterns clinically are observed as automatic negative thoughts or constant rumination, especially about the past or assumptions about the future, and the tendency of the mind to wander away in boring or challenging as well as stressful situations. If mindfulness or meditation is practiced systematically, it is postulated that such automatic chains can be broken. However, it's really important again to realize here that it all depends on the level of amygdala arousal and the strength of the prefrontal cortex. Recent studies correlate with the structural plastic adaptation effects in the area of the amygdala, which was seen to be shrinking following a standard 8-week mindfulness training program. So pretty fascinating that even a short course of mindfulness can make a significant difference to amygdala emotional arousal reduction. With meditation, the parts of the brain that tend to thicken are those associated with attention and memory, so the prefrontal cortex, interoception, the insula, sensory processing areas, as well as those related to self-regulation and auto-regulation. Interestingly, in athletes, mindfulness is used as a way of enhancing insular capability or insular activity to improve performance. Mindfulness meditation increases functional and structural activity in the somatosensory and insular cortex. Now, insula is the seat of interoception, and what it does is it integrates all the somatosensory stimuli that we have from our body, along with all the external stimuli as well. So what meditation tends to do is it improves the ability for both interoception as well as exteroception. In other words, what meditation practices do is that they enhance the ability to resist interference by perceived external stimuli with internal consciousness. So think about this in athletes, whereby the performance tends to be increased because they're completely in flow state and any external stimuli does not affect performance. In summary, although outcomes for mindfulness and meditation are currently speculative, they can be valuable tools for regulating cognitions, emotions, for relieving stress, and for improving self-perception to start to mitigate chronic stress, anxiety, and trauma. Regular practices of meditation and mindfulness techniques can lead to better overall mental and physical well-being. So to link the functions to the parts of the brain, very quickly we looked at the areas right at the start, but essentially the attention regulation area, which is the prefrontal cortex, the executive control network. The next the area for bodily awareness, which is insula. Next, emotional regulation, the amygdala and prefrontal cortex connection. And then self-regulation or self-perception, which is the salience network. Salience network is also the arousal part of the brain. Creswell and colleagues found that subjects with a higher level of self-attributed mindfulness, they display greater prefrontal cortex activation and deactivation of the amygdala when describing emotions. A big question though, is mindfulness and meditation for everyone? Can mindfulness be harmful? In clinical practice, it's not uncommon to see individuals who worsen with mindfulness strategies or even with meditation strategies. And this can happen particularly in the more severe forms of depression, melancholic depression with significant ruminations, or trauma-related disorders. Let's take the example of trauma-related disorders. We saw earlier that the benefits of meditation and mindfulness is that there is decreased amygdala activity and an enhanced prefrontal cortex activation. So when we think about post-traumatic stress disorder or the trauma response, we know that there are two phenotypes, two differential processes that link the prefrontal cortex to the amygdala. So not all individuals with post-traumatic stress disorder present exactly the same. Trauma treatment must therefore differentiate between patients on two different dimensions. So let me first cover the two phenotypes. We have the emotional undermodulation. You see, generally the ventromedial prefrontal cortex has an inhibitory role or influence on the amygdala. In emotional undermodulation, this prefrontal cortex is not able to inhibit the amygdala. Therefore, this presentation is associated with emotional hyperarousal and agitation, hypervigilance, flashbacks, etc. On the other hand, there is the emotional overmodulation. And in emotional overmodulation, there is an enhanced prefrontal cortex inhibition on the amygdala, very similar to what we see in meditation. But of course, in trauma-related disorders, this moves towards emotional numbing, depersonalization, derealization, and in the most extreme states, dissociation. So we know that the trauma response consists of a sequence of 6 somatomotor responses. Freeze and flight are the initial responses, the amygdala activation through a threat. This moves to fight, then to fright, and the last two are flag and faint. The flag and faint responses are moving towards depersonalization, derealization, and a shutdown, which is dissociation. Now, this emotional undermodulation and overmodulation can be divided into post-traumatic stress disorder without dissociation and post-traumatic stress disorder with dissociation. Now, I want to focus specifically on post-traumatic stress disorder with dissociation, because here what we see is that this involves amygdala deactivation, parasympathetic activation, and stress-induced opioid-mediated analgesia. Now, if you're a clinician, you would love the Academy. We cover this more in the Academy by Psych-Scene. If you want to delve deeper into structured psychiatry learning, head to the Academy where we have loads of videos, PDF structured courses to take your learning to the next level. Think better, think smarter, discover more, and change lives. So therefore, in trauma, we have to differentiate between those with sympathetic activation versus those that went down the whole defense cascade, leading to parasympathetic dominance, reduction in respiratory rate, reduction in heart rates, and moving more towards a dissociative responding. In this dissociative responding, there can be vasovagal responses, so individuals may even faint. You see, those that have a parasympathetic dominance, the issue is mindfulness and meditation techniques may actually be detrimental because it exacerbates the already present parasympathetic dominance. So patients with the dissociative shutdown form of PTSD, the so-called complex trauma PTSD at times, need assistance to actively fight the vasovagal dominance, the parasympathetic dominance, which leads to bradycardia, vasodilatation, and fainting. Here, relaxation techniques, mindfulness, meditation may worsen things. Therefore, in these situations, active motoric engagement may help to maintain arousal and prevent immobility, so to say. So relaxation techniques are at this point contraindicated. Similarly, for those patients where the prefrontal cortex is unable to control hyperarousal adequately, the focus on interoception may be detrimental. The reason why the focus on interoception may be detrimental as part of meditation and mindfulness is because of the negative value that may be attributed to events. This is known as the negative valence. So therefore, the instructions to control the ruminations may actually be detrimental because the prefrontal cortex is struggling, but all the arousal symptoms from the amygdala tend to put a negative value on all those ruminations, and therefore again the person can worsen. Know that meditators are trained to monitor their cognition and decrease self-referential thinking to maintain present moment attention. This is the basis behind mindfulness or meditation. This implies enhancement of two key parts of the brain. The default mode network, which is the task negative network. You see, this network is active when we're mind wandering, for example. It's active in the background when we're not necessarily needing to pay attention, when we're allowing our mind to wander, abstract thinking, etc. The task positive brain region is the executive control network, or the ECN. Now we know that when ruminative thinking is present, there is a decreased coupling between the executive control network and the default mode network. So let me take a step back and just explain this in a bit more detail. You see, this default mode network, in the context of self-referential thinking, needs to be inhibited to a certain extent from the executive control network. And we know in severe depression, this executive control network can be affected. And what that means is that this default mode network tends to run amok in a way, worsening those ruminative thoughts. I want to at this point talk more about the insula, because we talked about the importance of insula in meditation and mindfulness as well. It is a key part of the brain that's activated in mindfulness and meditation. The insula is part of the salience network, along with the amygdala and the anterior cingulate cortex. You see, in patients with severe depression, they can have an aberrant salience, particularly in the more severe end of the spectrum. This leads to increased interoception and abnormal interoception, excessive focus on their internal thoughts, but also internal sensations. And this can result in thoughts such as obsessional guilt, themes of doom, and nihilism. Similarly, the focus on internal bodily sensations can be misinterpreted or catastrophized, leading to hypochondriacal ideation or hypochondriacal delusions in extreme cases. Now, what happens if the executive network and default mode network connections are weak, as seen in severe depression or trauma? In fact, this exact executive control network and DMN network is significantly affected in melancholic depression. In such patients, interoception can worsen thoughts. Clinically, many patients will find mindfulness and meditation distressing in clinical practice. Once the executive control network is strengthened, so to say, and the balance between interoception and exteroception is achieved, along with prefrontal cortex control over the salience network, that's when mindfulness is more likely to be effective. Many a time in that stage, individuals are more likely to move towards activity as they've now discovered external rewards after being in a reward deficit state for a long time. So often they say things like, I'm so busy with other things, I don't think I want to sit and meditate or spend time with my thoughts. So it's really individual. Not every person finds meditation or mindfulness useful. A 2020 systematic review by Farias et al. Showed that the occurrence of adverse effects during or after meditation practices is not uncommon and may occur in individuals with no previous history of mental health problems. The most common adverse effects were anxiety, depression, and cognitive anomalies. Gastrointestinal problems and suicidal behaviors were the least frequent. In summary, meditation is helpful in the right situation at the right time for the right individual, but in others, it can be harmful. Recognizing this is important. So I hope that you found this video useful. If you liked it, make sure you hit the like button. Let us know in the comment section what else you'd like to hear from us. I look forward to seeing you in another video soon. Until next time, stay mindful.